So in this last section, I'm just going to go through a few of the homeostatic imbalances that involve the respiratory system. COPD, chronic obstructive pulmonary disease, actually consists of two subdiseases, chronic bronchitis and emphysema. Continual bronchial inflammation and irritation leads to chronic bronchitis. That causes edema in the bronchioles, chronic productive cough, and bronchospasm, leading to the inability to breathe and obstruction of airway. The breakdown of elastin and connective tissue of lungs leads to emphysema. Emphysema is the destruction of the alveolar walls, loss of lung elasticity, and air trapping. In other words, where you used to have all of those dividing walls between the alveoli, they break down, creating one large alveolus, which decreases the surface area for the exchange of gases. That also leads to airway obstruction, dyspnea or inability to breathe, and frequent infections. Eventually, you have an abnormal ventilation-perfusion ratio, hypoxemia, and hypoventilation, which leads to death. You've got this fluid that starts to accumulate in the lungs, and breathing out becomes such a chore. I remember my aunt, when she had passed away from COPD, she was trying to convince my brother to stop smoking, and she said, "Eric, it's like trying to breathe out into a balloon every time you take a breath. I'm just so tired." And that was one of the last things that anyone had heard her say. Smoking is very serious, and there's no kind of cheating away around smoking with using vapes and all that type of stuff. Anytime you bring toxic chemicals into the lungs, you're causing damage, and that damage has lifelong repercussions. So just be conscious and be healthy. Asthma. So asthma is characterized by coughing, dyspnea, wheezing, and chest tightness, and it's due to the active inflammation of the airways and then bronchospasms. So your bronchioles become inflamed, that smooth muscle becomes constricted, and you aren't able to get enough oxygen down to the alveoli. Air gets trapped in here, and that accumulates as carbon dioxide, and eventually turns into carbonic acid and can cause further irritation and erosion inside of the lungs. This is an immune response that's caused by kind of a allergic type reaction. So there's certain things that can stimulate asthmatic episodes. The airways are thickened with inflammatory exudate, and that magnifies the effect of the bronchospasms. Lung cancer. Lung cancer is one of the leading causes of cancer-related deaths in North America. 90% of all cases are the result of smoking or exposure to secondhand smoke. The three most common types are squamous cell carcinoma, adenocarcinoma, and small cell carcinoma. A pneumothorax says presence of air in the pleural cavity. This is a collapsed lung. So there's a couple things that can cause a pneumothorax. First of all, only one of the lungs is going to collapse. Unless there was severe damage to both sides of the thoracic cavity, each lung is contained within its own cavity, so they can collapse independently of each other. So the first thing that can happen is there can be an entry wound from the outside of the body, and that causes the disruption of this intrapleural pressure, and that's going to equalize with the atmosphere from the outside, leading to the collapse of the lung. The other thing that can happen is rupture from the inside of the membrane. So if you rupture the inside in between the alveolus and the intrapleural pressure from the inside, that can also collapse the lung. A collapsed lung requires immediate medical attention and requires a visit to a hospital in order to fix that lung. So it's treating by drawing out the air with chest tubes. The lung typically collapses due to a disruption of pressure, and lungs are in separate cavities, so one lung can collapse and the other can be just fine. Hypoxia. Hypoxia is talking about inadequate oxygen delivery to the tissues. Anemic hypoxia is due to too few red blood cells, Ischemic is due to a constriction in blood flow that prevents oxygen from getting transported to where it needs to go. Histotoxic means that the body's cells are unable to use the oxygen. Hypoxemic is due to reduced arterial oxygen content. And then carbon monoxide poisoning. Hemoglobin. We talked about the structure of hemoglobin and how oxygen binds to the iron in the center of the heme group of each molecule of hemoglobin. Carbon monoxide has a much stronger affinity for binding to that iron, and once bound, it doesn't let go. So because of that, carbon monoxide poisoning competes with those oxygen binding sites, so the blood actually transports less oxygen. This can be corrected by giving a concentrated dose of oxygen that can, kind of the pressure of the oxygen can overcome the carbon monoxide and displace it from the body. Eventually, you'll just breathe that out. But if it isn't corrected immediately, this can lead to death. How does our brain know that we need to take a breath? It's not because of oxygen receptors. We don't have oxygen receptors inside of our body that say, yep, we're deficient on oxygen, we need to take a breath now. It's actually the opposite. It's the need for us to expel carbon dioxide, which gets converted to carbonic acid if it's accumulating in the body. So, we have this bicarbonate buffer system. Carbon dioxide gets converted to carbonic acid and eventually bicarbonate. Carbon dioxide is transported through the blood as bicarbonate under most circumstances. And then when it gets back to the respiratory system, it gets converted back to carbon dioxide, and then we breathe it out through the respiratory system. But if this carbon dioxide can't be eliminated from the body, it accumulates as carbonic acid. Our brain has receptors for the presence of this acid, and that's going to cause us to respond by breathing hard, so hyperventilation or increase in respiratory rate, because we want to try to get that acid out of the body. If we don't, that acid accumulates, and again, that's going to denature enzymes, and it's going to shut down our metabolic processes. Eventually, we'll slip into a coma and die. But our brain has receptors for carbon dioxide, not for oxygen, which seems kind of different. There's metabolic and respiratory acidosis. Here we go. So acidosis or alkalosis can be metabolic. Metabolic is due to a change in bicarbonate levels. Respiratory is due to a change in the partial pressure of carbon dioxide, or having too much carbon dioxide accumulate in the body. So if we have respiratory acidosis, this means that we are becoming acidic because there's a blockage in our respiratory system. We have decreased alveolar ventilation, so we're not breathing enough, and that leads to a decrease in the elimination of carbon dioxide. Our pH is going to drop, and their partial pressure of carbon dioxide is the diagnostic key here. So we'll do a blood sample, and we'll say, yep, they have a lot of carbon dioxide in their bloodstream. It's observed in lung diseases, drug toxicity, mechanical obstruction of the airway, decreased cardiac output, impaired function of the respiratory center due to head trauma or sedation, anesthesia. Respiratory alkalosis is caused by the opposite end of the spectrum. So we have increase in alveolar ventilation and hyperventilation that leads to excessive elimination of carbon dioxide. They tell you to calm down and take slow breaths if you're hyperventilating. They tell you to breathe into a bag if you're hyperventilating. If you're hyperventilating, you're expelling too much of that carbon dioxide, and you need to start recycling some of that in the body to maintain the blood pH between 7.35 and 7.45. So we need to have some of that carbon dioxide stay in the body. So they'll put a paper bag over your face and have you recycle some of that carbon dioxide and calm you down when you're hyperventilating. This is caused by chemical stimulation of the respiratory center by drugs, Hypoxemia, induced hyperventilation, so induced by breathing oxygen-poor air. Fever, hysteria or anxiety, so that's again if you're having a panic attack and you're hyperventilating, they put the bag over your mouth to try to get you to recycle some of that carbon dioxide. Pulmonary embolisms, pulmonary fibrosis, other ventilation or overventilation by a mechanical ventilator, septicemia in some cases, trauma. So how do we compensate? If it's due to the respiratory system, if you have respiratory acidosis, your metabolic or metabolic compensation is going to kick in. So your kidneys are going to start excreting a lot of hydrogen ions. Your urine is going to become acidic. If it's respiratory alkalosis, so your pH of your blood has increased because of hyperventilation, then your kidneys are going to excrete bicarbonate and retain the hydrogen ions. These compensatory mechanisms are going to be extremely important once you get into the nursing program. So if you don't save anything else in this entire kind of lecture series, this is a really good table, and I find it really useful even with my clinical diagnostic stuff. Compensatory mechanisms are key in how you would address or how the body kind of responds to metabolic and respiratory alkalosis and acidosis. And the last homeostatic imbalance that I'm going to talk about is cystic fibrosis. This is a lethal genetic disorder. It's due to a defect in the cystic fibrosis transmembrane conductase regulator. It normally regulates the electrolyte transport across the epithelial membranes, but mutations prevent the transport of sodium and chloride into the mucus-producing epithelial cells, so there's lots of extracellular chloride. That extracellular chloride results in thick mucus production in the lungs and digestive tract. Symptoms include chronic or recurrent respiratory infections due to all that mucus being present, pancreatic exocrine dysfunction, endocrine dysfunction, meconium ileus in the newborn, coughing, wheezing, breathlessness, constipation, greasy stool, poor weight gain, and that's all because of excess of mucus production in the digestive tract and respiratory tract. There is no cure, although there are new treatments that have become available. And these treatments are made using bacteria, like genetic transformation, and these treatments show some promise. But still, with those treatments, life expectancy is in the mid-40s. The way to test for someone with cystic fibrosis is the sweat test, so the chloride sweat test. If it's greater than 60 millimole per liter, that's consistent with cystic fibrosis. If it's less than 40, then it's considered to be normal.